excited to see. So thank you very much for joining us. We will just give it another minute or two for people to join who are maybe having connection issues and navigating Zoom and all the usual. And then I will start to introduce our speakers in the course of the evening. So I'll just go quiet just for a minute whilst we let some people join. So I can see that there's still lots of people joining the call, so we're just going to give it just a little bit longer to let people come into the webinar before making a start officially. Okay, we've still got lots of people joining us, so I will just do another welcome to people who've just joined in the last minute while we've been waiting for people to navigate the waiting room into Zoom, etc. So just to thank you all again for taking the time to join our webinar this evening. My name's Kate Thompson. I chair the Education Committee for the British Pain Society. And I just said earlier, we're really happy to be and excited to be hosting this webinar this evening. We've got loads of people registered, which we're so happy to see. So I will save official thanks for the end, but just before we start, I did just want to thank the Patient Voice Committee at the British Pain Society, who have driven the idea for this webinar, but also have been instrumental in reaching out to their networks to bring speakers together this evening. So a massive thank you to them. So tonight we have a range of speakers who are all representing their organisations. I will introduce them throughout the course of the evening as they come up to present. But just as a quick overview, we have Millie Love joining us from Versus Arthritis, Samantha Fielding from Flippin Pain, Victoria Abbott-Fleming from Burning Nights. Emma Davis was unable to join this evening, but has provided some materials for us to share from Live Well with Pain. We've got Pete Moore, author of the Pain Toolkit, and Rachel Stovall and Claire Jacobs from the Physiotherapy Pain Association. So the purpose of tonight's webinar is that our speakers are hoping to share what's out there in terms of education, in terms of support, resources, training, if that's the right word to use, for people who are living with pain. And in that way, we're hoping that the webinar will be of interest and helpful for quite a wide audience. That includes people living with pain, their families, friends, carers, along with people who work in health, who work in communities, who are supporting people living with pain, and of course trainees and pain researchers as well. So the plan for the evening is that each of our speakers will give a short overview of their resources. We've got some slides, some materials to be able to share in the webinar. They will do a short presentation to signpost, to share and raise awareness of what's available. And then we're hoping at the time to have plenty of time for questions and answers. We did also just want to say that we know that this isn't an exhaustive list, that there's many other resources available that have been developed by individuals, communities, services, and we hope that we might capture some of that as examples and part of the discussion at the end. So if you are in the audience and you've got some other resources and things that you're aware of, then please feel free to share those also as part of this webinar. Okay, so the final bit from me, just before we hand over to our speakers, is that we will use the Q&A to the chat box in the Zoom control panel, where you can type your questions. And if you want to direct that in particular to a particular speaker, then just sort of direct that in your question. Or if it's a general question open to the panel, then we're happy to take those as well. The webinar is being recorded and it will be available in our British Pain Society YouTube channel at the end. So just before I hand over to our first speaker, there's just a little bit of background information there on the screen about the British Pain Society. We don't want to assume that everybody knows who the British Pain Society are, so there's just a little bit of information about some background there. And on the next slide, just an awareness or a reminder, if people are aware, that we have got our 58th annual scientific meeting coming up, which is just in 2 months' time, which is in Newport in Wales this year. So if you're not aware, or if you registered, brilliant, we look forward to seeing you there, and if not, then it's not too late to register. And then my last slide is just some bits I've covered already, but just as a gentle reminder, if you've got questions, pop them in the Q&A chat box in the Zoom control panel. The webinar is being recorded. It will be available afterwards. And if you can please fill in an evaluation form to claim your certificate of attendance, that would be brilliant, and you will receive a link to be able to do that. So I'm going to stop talking. I'm going to hand over to our first speaker this evening, who is Millie Love. So Millie, if you're ready to come on camera there in a sec. So Millie is Professional Network and Insight Manager in the Professional Engagement and Education team at Versus Arthritis. And Versus Arthritis is the largest musculoskeletal charity, funder of musculoskeletal research in the UK. The charity provides information and support for people with arthritis, and healthcare professionals invest in research to make life-changing breakthroughs and advocates for change through policy and campaigning network. So I'm going to go off camera now for a few minutes and just welcome Millie. Thank you very much.
Good evening, everybody. Thank you very much for inviting Versus Arthritis here tonight. We're really pleased to be able to share the resources we have available, and thank you to everyone for attending too. I know an evening session can be quite tricky, so I'm looking forward to talking through the support that we've got available. So Versus Arthritis is, as Kate just mentioned, kind of the largest arthritis charity supported by volunteers and the kind of largest funder of MSK research in the UK. We influence governments across the UK to improve policy for people with MSK conditions, train healthcare professionals and workplace professionals, provide local services and support, and have free support and services such as our helpline and online community, and our health information. So in terms of the need for our work, we know that there's over 20 million people in the UK living with an MSK condition, including 10 million people with arthritis. We know that pain has a massive impact on people's day-to-day life, but it's not just pain. Fatigue, stiffness, loss of dexterity and mobility. People with arthritis are 20% less likely to be in work than somebody without arthritis. And the cost of working days lost due to arthritis is estimated to reach 3.43 billion by 2030. And depression is 4 times more likely for people in persistent pain compared to those without pain. And around 15.5 million people in the UK, 34% of the population have chronic pain, and there's a lot of kind of inequity in who experiences that pain as well. So the scale of the problem, so we know kind of across the UK, 29% people in Northern Ireland have MSK conditions. That's 33% in Scotland, 32% in England, and 32% in Wales. All of these stats that are on here come from our State of MSK health report, which we publish each year. At the end of this talk, I can put links to all the resources in there. There's full of information about kind of the levels of prevalence of MSK conditions and chronic pain condition as well. So in terms of the support we have for people with arthritis or MSK conditions, we offer free, informative, easy to read health information. So we have a range of booklets that cover kind of conditions, medications, and lifestyle factors, the fatigue and sleep with arthritis. We've got our free helpline, which is staffed with experienced caring advisors from Monday 9 till 6 p.m. The average call length on our helpline is about 37 minutes. So it's a really kind of thorough level of support and service. And we also have an online community where people experiencing MSK conditions and arthritis can come together and talk about the issues they're facing and access peer support. I've put QR codes to all the resources on the slides, but again, I will share the links at the end. We also have a range of physical activity resources. These are designed specifically for people with arthritis and MSK condition. We know the research tells us the benefits of physical activity resources in terms of reducing pain and improving energy levels and kind of how people are feeling about themselves. But we also know that when people are in pain, it's not that easy to be motivated and or feel able to take part in physical activity. So all of these resources are designed to to enable different levels of access. And there's a whole program that people can sign up to provide that motivation over a 6-week, a 12-week program, apologies. All the videos are with Leon and his mum, who experiences arthritis, and they show the kind of modifications that people can make to access those exercises. We also have a range of adult services. So across the UK, we're a 4-nation charity. So we've got a kind of range of self-management courses, a 5-week peer-led course that begins to focus on the skills for people to self-manage their condition. There's specific support in terms of pain, fatigue, sleep and anxiety, as well as our arthritis awareness sessions. So they're specific kind of webinars or courses that people can sign up to. We've got some physical activities too. So CHIMI, boccia, I'm never sure I say that right, as well as walking groups. And then we offer community networks across the UK as well. So these are kind of peer-led branches of the organisation that meet to offer kind of friendship, put on information talks, sometimes fundraise, but kind of really build that sense of community with people going through the similar experiences. And again, QR code and link to find out kind of what's available across the nations and in your area. Although there's common perception that arthritis only affects old people, we know that that is definitely not true. So we have a range of services for young people and families as well. They provide kind of a lot of self-management courses and events and residentials where young people can come together. Often they feel isolated and peers don't understand their conditions and how it impacts them. So they can come together with people, again, going through similar experiences. There's peer support, one-to-one support with youth and family workers, a lot of kind of support in hospitals, in waiting rooms, to support young people to access the services they need, and then a series of support for schools, for teachers and educators, and for young people making that transition from school into universities or early career. And there's a lot of information, opportunity for youth involvement as well, to join our young people's panel and help inform our work and set our priorities in terms of advocating for change for these groups. The decision support tools are another resource that's available on our website. So there's 8 tools available. These were co-designed with people with arthritis and kind of include a number of factors that impact people's day-to-day life and support to kind of communicate the impact of pain and arthritis with healthcare professionals. So again, they're all available on the website, and there are a couple on the NHS England website, which are a bit more detailed as well, for hip and knee osteoarthritis. We also have a tracker app. This was originally designed for young people, but actually kind of that it's not specifically for young people, and it can be used much more broadly. This really helps people experiencing pain and symptoms of arthritis and MSK conditions to track those symptoms, to be able to report more accurately back to healthcare professionals what's happening for them and the impact that's happening. And again, there's a QR code available there to download the app on people's phones. It also tracks kind of alongside pain, but kind of mood, sleep, medication side effects as well. We also have workplace support. As I mentioned at the top, we know that people with arthritis are 20% less likely to be in work than people without MSK pain. So there's a range of information on our website for people with arthritis and workplace professionals, and we have just hot off the press published our work adjustment plan. So there's some copies of it there, but again, I will put some pictures of it. I will put some links in the chat. That's really designed to kind of take a kind of really purposeful tool for people to explore their symptoms, their condition, how that impacts them, and what adjustments that they can make at work with their employer if they feel comfortable to share that information as well. As well as kind of the support for people with arthritis and MSK conditions, we offer training for healthcare professionals specifically. So we have a session on managing chronic pain in primary care that covers the NICE guidelines and what they mean for the doctor and the person experiencing pain. Consultation skills to manage kind of challenging interactions. We know that people with arthritis and MSK conditions don't often feel heard and understood. And the kind of impact of their pain is dismissed. So kind of really kind of examining kind of that impact and the kind of support that people with arthritis need. The principles of medication use and resources that can help. If you're interested in that training, then there is, it would be best to get in touch with our education team directly on the email there. However, you can also sign up for our professional network. So there's a QR code. We send out quarterly updates and kind of other communications, information about upcoming training and events. As you can see, for the International Women's Day, we had a large piece on the gender pain gap, which might be of interest to people on this call, but also things like promoting webinars such as this relating to pain and other MSK and arthritis events for healthcare professionals. We also have a selection of stories of change. These are case studies of people working in health across the UK, trying out, having a go at improving services and sharing what's worked well, what's been really effective, but also what their learning is. We recognise there isn't a one-size-fits-all approach that will work in every healthcare setting. So these really are meant to be a kind of a story, what people have tried, what are the successes, but where are the areas for learning. And then again, there's a number of these that focus on kind of improving pain services. We also, as I mentioned, fund are the largest MSK research funder. We've again recently published our Pain Centre Impact Report. There's a lot of learning in that and a lot of takeaways, both for people experiencing pain, but also healthcare professionals in terms of the impact of pain and tools to support. There's a link on the page there, but again, I will share the link to the whole report in the chat shortly. As part of this kind of research involvement is a key area for us. So the principle is nothing about me without me. So there's lots of ways for people with arthritis and people experiencing pain to get involved in our research and to help shape the research and what you'd like us to kind of invest in going forwards. I'll share again some links at the end in terms of how to get involved. And as mentioned, we have a large policy and campaigns team as well. And we've kind of been doing a lot of influencing activity, especially with well, not so new government now, but there's a lot of changes happening, as I'm sure we all know, in the NHS. So over 130,000 people have signed our letter to the Prime Minister, and we've got kind of 5 key asks in terms of our policy and campaigning to improve the services for people with arthritis and MSK conditions. And we want the government to kind of prioritise MSK as part of their plans going forwards. And so finally, there's just ways to get involved. We know how rewarding that kind of getting involved in supporting other people with pain and MSK conditions can be. So there's lots of information, talks and opportunities to present to peers through our volunteering schemes, fundraisers, the change makers, our campaigners, and research volunteers. So again, I will post all the links to how people might want to get involved in those activities in the chat shortly. I think that's it from me. Stop sharing.
That's great, Millie. Thank you so much. If people have got questions for Millie, you could start to pop them in the chat if you want. But what we'll do is we will save all questions to the end. We'll come back to them. But by all means, if you've got things that you don't want to forget whilst we go on to the other speakers, then feel free that you can post in the chat there. Thank you very much. So our next speaker is Samantha Fielding, who is the lead campaign manager for Flippin Pain. Flippin Pain is a public health movement sharing the often surprising science of pain with people who need it most. And research shows that understanding the science of pain can be a game changer, and it can change how we think about persistent pain, what we do about it, and even how it feels. So Samantha's just come onto camera there, and I will hand over to you if you're happy and ready to go. And I'll just give you a second to get your slides sorted, ready for sharing.
I am. Thank you very much. Let's try. I can't remember what I did now. Let's share this like this. Just waiting for it to work. Great. Thank you so much, Kate, and thank you so much, Millie. That was such a great start. So, hi everyone. My name's Sam. I'm one of the campaign managers here at Flippin Pain. So I'm just going to talk a bit about what we do. So simply put, Flippin Pain creates events and online information to help people understand the science behind why pain happens. And you might be thinking, why do we bother doing that? So basically, we do this because there's been a lot of new discoveries about pain over the last 30 years, but we find that these kind of discoveries haven't found the trickle down to the average person on the street. So obviously I had to Google the average person on the street, and this is what I got. I don't know whether this is the same in your area, but basically it just means that there's a lot more to pain than we once thought, and we want to give this information to as many people as possible, and the people that need it the most. So people living with pain, people supporting people living with pain, even healthcare professionals. We know quite a few health professionals haven't had the opportunity to really get to grips with this stuff. So we want to make it easy and fun to do so. So when we talk about the new science of pain, one of the main things that we talk about is this idea of hurt doesn't always mean harm. So we now know that there's a big difference between the amount of pain that we feel and the amount of damage that's actually happening in the body. And actually we can see this in relatively normal everyday life. So if you've ever woken up with a bruise and not known where you've got it from, that's a good example of there being actual damage to the body, but not enough pain for you to even remember it. And alternatively, the kind of opposite of that, you know, if we've ever stood on a piece of Lego or a plug or something like that, there's a really, really intense pain experience. But actually, you've not broken the skin, and it's very minor kind of injury at all. So there is a really big difference between the pain that we feel and the kind of damage or injury that we're experiencing in the body. And in persistent pain...
Sam, sorry to interrupt. We can see your notes, so maybe
oh, sorry.
Go to the presentation mode.
Of course we can. 1 second.
Thank you.
I think I can hide presenter view like that. Luckily, I've printed my notes out, so we're all good.
Perfect.
So yeah, so essentially, why do we have it then? If there is this big difference between the amount of pain that we receive and the actual damage that's happening on the body, why does that happen? Well, it's all about protection. So it's not about detecting damage in the body and trying to say that we are injured. It's about protecting us from damaging ourselves further. And this leads us to our next kind of thing, which is the car alarm. So I think we can all agree that car alarms are kind of a good thing. You know, they protect the contents of your car, the car itself. But actually, if you're like me, you live in an area where there's some oversensitive car alarms, you know, a stiff breeze can set them off. And it can be a really stressful experience. It can be not helpful at all. And that's kind of where we see the kind of oversensitive car alarm aligning with persistent pain. The body's trying to protect itself, the pain system's trying to protect you, but actually it's become so oversensitive, it doesn't know the appropriate times to do this. So essentially, with Flippin Pain, we like to think about how we turn the volume of that oversensitive car alarm down. And there's lots of different ways of doing this. There's lots of different aspects of life that can help with this. And I don't have much time to go into the science of that, I'm afraid, today, but I hope this has piqued your interest enough to find out more. So if you do want to find out more, we have a lot of free resources on our website, so that's flippinpain.co.uk. And this includes the Flippin Pain formula. So the Flippin Pain formula is a group of podcasts, animations, and worksheets designed to help patients explore the world of pain at your own pace, hopefully in an entertaining way and an easy to understand way. These are also available on streaming services like Spotify, and we also have a number of webinars that kind of share the same information, and they're all on YouTube. So please do check that out. We also have kind of sort of events and training that's coming up, and you can find these on our website as well. You can also sign up to our newsletter there for kind of updates on that. And actually, we also now have a new platform called Why We Hurt, which is a digital activation platform, which is a fancy way of saying it's a more in-depth version of the formula that's kind of built with people living with pain. All of these things are kind of what we call free to the end user. So if they're on the website and they're for your either public or professional, feel free to come. We can also put these things on, and for access to Why We Hurt, we often need a bit of commission for those two kind of things. So if you're a professional that's got a bit of budget or that kind of thing, please do get in touch, because we can be really flexible with that and kind of make sure that we can give you the options available. Okay, so you might be thinking, does this actually work? You know, what is the point of this? Why do we bother doing it? And actually, the research has shown that understanding your pain can be key. So it can make you feel more in control of your pain, and it can make you know the most effective ways of making a recovery. So to just show an example of this, this is one of the studies coming out of Australia from our partners Pain Concern. And so what they did here, they took two groups of people with similar amounts of pain, persistent pain, I should say, and they gave them both support through pain management, but for one group, they also gave them this pain science to kind of learn and understand. And the results were quite surprising. So over 1 month, there wasn't really much change at all. But then from 3 months, 6 months, a year, there was a significant decline in the pain that they were experiencing. And this is in contrast to the people who didn't learn that science of pain, who didn't make much of a significant change at all. Now, there's a lot of different reasons and elements to this, for sure. And we're not going to say that learning the pain science is like the be-all, end-all of pain management, but we think it gives the right tools and the right starting point for people to make a good, positive recovery. It's the first step, and we want to be that first step for you. And we know that recovery is possible because we talk to a lot of people who have been benefited by this kind of stuff. So people who've gone on after learning this information to put in their best foot forward, knowing the kind of things that work for them and kind of building a plan of change. And everything that we do at Flippin Pain is co-created by people living with pain. So I just wanted to leave you on 2 stories from people that have worked with us. So essentially, number one is Libby. Libby works with us quite a lot, and she's got chronic regional pain syndrome. And she's gone essentially from the lowest time point in her life to now actually saying that she lives in a better way than she ever did before the pain began, which is obviously extremely encouraging to hear. But it was that kind of understanding of pain and what she could do for herself that has allowed her to get there. And then the second story is Ivor's. So Ivor had a lot of persistent back pain. He found it very hard to even walk, down his drive, and ended up actually in a wheelchair for a long period. But by learning the science of pain, getting on the right road, he was able to kind of gradually increase his movement and is now literally climbing mountains, which is just such a lovely metaphor and story. So I hope this has been quite hopeful and helpful, and that Flippin Pain can be part of your next step. Thank you for listening, and I'm sure we have some time for questions later.
That's great. Thank you very much, Sam. And just same as before, if there's any questions particularly that you've got in your head at the moment that you want to ask Sam, then feel free to pop those in the chat, and we'll try to get to as many questions as we can at the end. So fabulous. So our next speaker is Victoria Abbott-Fleming, MBE, who is the founder and CEO of Burning Nights, which is a national charity dedicated to raising awareness of complex regional pain syndrome and supporting those who are impacted by the condition. So after being diagnosed with complex regional pain syndrome herself after an accident at work, Victoria established the charity 10 years ago in order to provide vital resources, advocacy, and a sense of community for people and their families. So I will hand straight over to Victoria, who's just come on screen. Thank you very much.
Thank you, Kate, and good evening, everyone. I'll just share my screen. Hopefully you should all be able to see that now. So good evening, everyone, and thank you for taking out some time tonight, especially at this time. As Kate explained, my name is Victoria Abbott-Fleming. I am the founder and CEO of Burning Nights CRPS support charity. I've lived with complex regional pain syndrome now for 21 years. I also have neuropathic pain and phantom limb pain. I'm also the chair of the Expert Patient and Carer Committee at the British Pain Society as well. And Burning Nights is considered the leading national charity specifically aimed for anyone impacted by complex regional pain syndrome, which does include all the family, friends, caregivers, whether they're unpaid or paid. The main point for our charity, the main aims are that we work to improve the lives of those impacted by complex regional pain syndrome. We know that CRPS is not just patient orientated. It's not the only person that has to deal with CRPS. It is a very much of a ripple effect, the families, the friends and caregivers. And one thing that our charity does do is that we will support anyone in the family. Our main 3 pillars of the work that we do are orientated around awareness, education and support. And we just believe that no one should be impacted with CRPS and to be left alone. But to put it into practice to where our services sit, which I'll go through in a minute, but generally a quarter of the time we do spend on emotional well-being, and we've got a number of services for that. Peer support, we have over 75% of our volunteers are either living with complex regional pain syndrome or chronic pain or chronic illness. We provide education as well as awareness talks, exhibitions and the website. And we've just started our first campaign in conjunction with the Spinal Injuries Association and their female health. So let's delve into more about the services that we offer. For patients and for healthcare, we have the evidence-based website, which includes information on all aspects of not just living with CRPS, but also managing it and self-managing it. We know that CRPS is considered a rare condition, and you may or may not have seen it in practice. However, we do see a lot more patients, and over the time we support approximately 5,000 patients and families each year. We have a telephone helpline that's manned by lived experienced patients and families, as well as our staff. And that is open on Monday to Friday, 10 till 4. We have a dedicated email support system, again, run by volunteers who are lived experience. We have social media support, so we do provide a lot of support through direct personal and private messaging. We are on various platforms such as Facebook, Instagram, TikTok, LinkedIn and Pinterest. And we do provide quite a lot of support over the time. Approximately, we deal with 1,500 messages each year just on social media. We have a new online community forum that's just been launched with our new website. We also have live web chat, and on average, we can spend around an hour and a half on each web chat that comes through. That one is open 6 days a week because we've extended it past the time that our helpline is open. But our two biggest services that we now have are the online counselling and psychotherapy service, and also the befriending service. The counselling service is run with a clinical lead in place through National Lottery funding, and that we offer up to 21-hour sessions of counselling and or psychotherapy, and that includes person-centred, integrative, EMDR, CBT. This is for anyone over the age of 12. For under 12s, we offer 10 45-minute sessions. And we have quite a long time where sessions can take place. They can take place Monday to Friday between 9 and 8. This is one of our biggest services. We have 16 therapists running currently, 5 clinical supervisors and a clinical lead. The virtual befriending scheme, so it's on the phone, or it's on Zoom, just like here. And we offer 12 weekly calls or video chats of approximately 45 minutes each. However, in practice, it's more like the length of about an hour. One of our volunteers, sadly, who's passed away, she actually put in 35 and we presumed it was just 35 minutes. She actually meant 3.5 hours. So they can be lengthy. Patients and families feel very isolated, and our services are aimed to reduce that isolation and reduce the loneliness about living with a rare disease. The other support services that we can offer are monthly online support groups. Currently, they're only available for adults, anyone over 16 and 18 plus. We are looking to restart our young person support group and also our carers and families group. Our national conference was it still is, our one and only event that is face-to-face, and we bring in many speakers in through have knowledge of CRPS, chronic pain and disabilities. We have online webinars and wellbeing events. We've had Tai Chi, we've had dance, we've had all sorts of wellbeing events to help learn self-management tips, tools and ways to live. The membership scheme is something that we've started to offer now, and that is open to anyone worldwide, not just UK based. The membership scheme is open to anyone who wishes to support us, but obviously obviously as well as CRPS patients and families. Currently, we've got 10 monthly CRPS educational webinars running for the next 10 months through grant funding in conjunction with Health Sec Rehab and then neurophysiotherapist. These are tailored towards gearing patients and their families to understanding more about the condition, how it actually impacts people's lives and what they can do to help. So, for example, topics will include wellbeing events, they'll include daily living, they'll include living aids, disability aids, the latest technology, and what is CRPS. We also offer awareness sessions to professionals and to students as well. We do attend occasional exhibitions, for example, the primary care exhibition, to raise not just the profile of the charity, but also of the condition. Most people have never heard of CRPS, even today. We do have a small legal panel, as well as awareness products and information leaflets, and fundraising support, obviously. So referrals, how can you refer into us? 90% of our referrals come in from self-refer. Everyone else can refer in though, so we can, and we still do receive referrals from professionals, including social prescribers, parental or guardian referrals for under 18s as well. As long as they have been impacted by complex regional pain syndrome. But we will also take those who are under investigation for CRPS as well. We know and we understand that the length of time getting a diagnosis for CRPS can be quite lengthy, can be up to or more than 2 years. So we want to make sure that we want to include those people that may have complex regional pain syndrome as well. So how can we offer you support as well as health professionals? So we can send up to packs of 50 information leaflets, and we have them for adult CRPS, children and young people, but also DRG, dorsal root ganglion, neuromodulation booklets. And we also have how to support a young person living with CRPS. All of our leaflets are co-produced. We also can send you posters that detail our services, what support is available, and also about the condition as well. We can also deliver, as I said, in-person and online awareness sessions, and they are bespoke to each team, clinic or hospital. And obviously you do have online use of the helpline, the website, and obviously live chat. And we do accept, as I say, professional referrals for any of our services. Thank you for listening.
Fantastic, Victoria. Thank you so much. That's such an incredible offer when you see it all presented together like that. So thank you very much for that. And I'm sure there'll be some questions coming in for you shortly. So I'll move on to our next speaker, who is Pete Moore. So Pete has been promoting pain self-management since 1996 after attending the Input Pain Management Programme. He's the author of the Pain Toolkit booklets, which launched in 2001 and are supported by the Department of Health and Social Care, or they were between 2004 and 8. Last year, along with colleagues, Pete launched the Educational Online Pain Toolkit Academy, which is a not-for-profit organisation to support people living with persistent pain and allied health care providers worldwide who support them. So Pete has just come on camera there. I'll hand over if you're ready to be able to
share. I'm just trying to find well, my screen. I can't see the PowerPoint.
Okay, don't worry, we're fine time-wise. Just take your time.
No, should be on there, but I shared it earlier on.
Yeah, it was working earlier, wasn't it, when we jumped on early?
Do you want me to go freestyle?
I'm wondering whether Rachel, I know you weren't expecting this, but should we move on to maybe Rachel and Claire? If you've got your presentation handy, and then we could just come back to Pete, just change the order.
Yes, we can do.
Is that okay? Pete, is that okay? Then
Yeah, sure.
You just have a little more time then, just to be able to start up
Okay.
your presentation. Okay, hang on then. Let me just go back to my introductions. So we've got both Rachel Stovall and Claire Jacobs with us on the call. So Rachel is a physiotherapist with more than 30 years experience. Rachel's worked in the musculoskeletal field, both in the NHS and the private sector. She was an advanced practice physiotherapist in the pain management and the lead physio in facial pain at the Easton Dental Hospital. Currently, Rachel is working freelance and is a member of the Live Well with Pain team. And I'll introduce Claire at the same time, because I think you might just be going between the two of you in your presentation. So Claire is the physiotherapy clinical lead for Input Pain Management at St Thomas's NHS Trust, senior lecturer in physio at Brunel University, and has been working in pain management for over 30 years. So together, Rachel and Claire are the co-chairs of the Physiotherapy Pain Association, which is a professional network of the Chartered Society of Physiotherapy, which is a growing, innovative, vibrant network committed to advocating for people living with pain and supporting clinicians, students and researchers. So I will hand over. Thank you very much for just jumping in there.
Thank you, Kate. I'm going to start and then I'll probably hand over to you, Rachel. Thank you for all the fantastic speakers before, and this kind of follows very much on and building on what you've been speaking about. So I just thought we'd just start with just a slide on, if we, Rachel, move to the next slide, just to show and acknowledge the complexity around pain. Now, I've just, for this particular slide, chosen pelvic pain, but really just to kind of acknowledge that is so much going on for everybody, and why living with pain is so complex and hard to navigate the system. We know that there's emotional, social, physical, and I've only probably touched the surface of some of the things that are going on for people living with pain. But we also know that the clinicians who are working in the environment and with you are also needing that support. And the Physiotherapy Pain Association is very much geared towards coming from both sides and looking at how we start to kind of work together to share the experience and share the knowledge to help people living with pain. Can I move to the next slide? So the Physiotherapy Pain Association, as Kate said, has been running for over 30 years. And we continually adapt, we continually listen to our members to see what is something that is useful out there. We are a professional network, so we're a voluntary organisation run by physios, for physios, and for our patients. It's open to all chartered physios, whether they're in the NHS or private practice. Lots of people are working solo and are on their own in clinics. And actually, there's a huge need to support one another and come together to kind of share our learning and think again how we can best help those who need it. So we have about 500 members. We very much focus on our students. We have early career physios. And actually what we know is that if we can, I suppose, sort of speak to physios as they're just starting out in their career, to actually start thinking about pain differently and think how might they approach the interactions and the conversations that they have right at the early start of their career as a student and when they start work. So that then, you know, we often hear people say, oh, I had physio, I didn't like it, they didn't listen to me, da 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 da, and there are things like that that we can start to work with. So we work, as I said, with early career physios to those working in specialist centres and everybody in between. Co-production is at the heart of what we do, and we have very fantastic people who are with lived experience on our executive committee of the PPA, and we are very, very interested in that their voice gets heard. It's something that we value highly. The Physio Pain Association, we're collaborating. We are we're a small organisation, but we link with other professional networks in terms of sharing education, training, clinical development, reflection. And some examples of this is the Paediatric Association of Physios. We're at the moment developing some videos together on conversations around kind of conflicting values in terms of pain and therapeutic alliance when you're working with an adult child therapist and all the things that can come up in those interactions. We also link with the Musculoskeletal Association of Chartered Physios. So as we know, physio crosses many different areas in terms of neurology, pelvic pain, musculoskeletal, pediatrics. And actually what we know is that pain is the most common complaint for people seeking care. So we know that there are health inequalities to access care, and we can't ignore pain very much in terms of pain itself, the way that it's kind of constantly grabbing our attention. We can't ignore it, but we can't ignore finding ways to better work and help those who are living with pain. Thank you, Rachel. Can I move to the next slide? So we do have a mission statement for the Physio Pain Association, and this is in detail on our website. There are actually 10 parts to it, but I just pulled out a couple here that I thought might be useful and interesting. The PPA champions physios working across all specialties in contemporary physio practice, drawing on biopsychosocial and narrative approaches to support people living with pain. And a couple of those are to value the experience of those living with pain and to work with the voice of the patient in the development of PPA strategies and training, to support quality training, education and peer supervision for members of the PPA, to facilitate reflection, clinical development, innovation and shared learning, and to provide a community of practice to share knowledge and experience in order to improve outcomes for people living with pain. So this is a big ask, and there are lots of things that we can actually do to help our members, and hopefully then this filters back into the workplace to help you. I'll do the next slide on education, Rachel, then I'll hand over to you. So some examples of the things that we're doing currently at the moment is we're providing a peer support and reflection group for members and non-members. And this is an opportunity for people to come together to, in a safe, confidential space, to discuss some of the complexities within the people that they're working with, and to perhaps take a little bit of a different perspective and think, how might I approach this differently, and to discuss that with their colleagues. We do annual study days, which is all about sharing, learning and disseminating, and also collaboration with professional networks. And a couple of examples of the upcoming courses that we're running at the moment for our physios. So what we know is that people with pain have experienced moderate to high levels of distress, psychological distress. And we know that physios lack confidence and training in these areas. So we got a couple of courses. We've got a narrative-based approach to conversations called Conversations Inviting Change. And actually that's for GPs, allied health professionals, and other people working within the healthcare system. We've recently run Demystifying Pain for Early Career Physiotherapists, and some academic writing, and also some psychologically informed collaborative conversations. So there's a lot going on. We're here to support other groups as well for teaching on pain, complexity. We all know that living with pain, there's a lot of uncertainty, and it's how to kind of navigate our way around managing everything that comes up, how it can feel when somebody comes to see us and we're kind of like, what do I do now? How do I manage all the distress? So looking at how we look after ourselves in that process as well. So Rachel, are you okay to hand over to you?
Thanks, Claire. I'm just going to apologise for keeping my video off. I've just had a little bit of a problem with connection, and I found that if I keep the video off, then I should be able to stay with us, fingers crossed. Following on from what Claire said, and we're really grateful for being given the opportunity to join everybody today and to be able to highlight the work that we do in supporting physiotherapists. But as Claire said, also some of the courses that we run are open to other healthcare professionals who work within the pain field. We offer other support and resources. So we do have links for people living with pain on our PPA website, and we try to draw together from some of the other people that also might be here, and to be able to be sure that, I suppose, that there's a shared space of offering similar information. So it was quite interesting, I think, to hear from Sam earlier about helping people to understand how pain works. And one of the things that we do within the Physio Pain Network and the PPA is to be able to also be sure that that information is disseminated through to our members, and to be able to be sure that the information that we're giving to those that work is also along the same lines. To that end, we run our own journal. We have a journal called Pain and Rehabilitation, which is an online journal that's available to our membership, but is also available to other people to look at what we're doing and what's being published. And we encourage our own members to write pieces and to support their own research that we can then publish for them. It can be quite difficult to get published in some of the big pain journals, especially for people who might be doing small group work. And so we like to think of ourselves as a space and a platform to be able to give people a chance to be able to publish things that might not get seen elsewhere. We offer research bursaries, and we've had a few in the last couple of years to be able to support people. So we'll be able to help give them some finances towards research, where again, it's a very competitive market, as we all know, a very competitive space to be able to do research. And we we like to be able to offer a little bit of support in that, especially when people are undergoing perhaps early career study and things. So we're there to be able to do that as well. We choose to listen to our members. We like to be able to take a space to be able to support people who are working alone, particularly in the pain field. So and that's certainly the case sometimes, I think, with people working both in the NHS, but sometimes significantly within the private sector, where they're coming across a lot of people who are significantly impacted by long-term pain, but don't necessarily have the connections with other people to be able to hear their own voice heard and to be able to get information and support. So we might find that someone's also the only senior physio in a workplace, and they might need support too. So all of those things are available to our members. If anybody's here listening who happens to be a physio who isn't part of the PPA, then we'd obviously encourage you to join us, and our links will be on the website and being able to join us today. So a little bit of a plug for ourselves, but I don't think there's any harm there. And then also just really finally to say that maybe there are a couple of questions to consider here when you're listening to us. Maybe you're somebody who's struggling with pain and you're not sure how to make your own interactions with the physiotherapists that you work with work better for you. So maybe a question you might be able to ask the person that you're working with, or think for yourself, is how can I make my physiotherapy encounters more helpful for me? What do I want from it? And how can I bring that to the person that I'm working with? You might also yourself decide that you would like to work with somebody who actually is a member of the PPA, and there are you can contact us, or you can have a look on our website to be able to see where you might find that information and who is aligned to us, if you think that perhaps things might be different if you are working differently. And then also other questions that you might want to ask yourself or even put to us are things like, what would you like more of in a physiotherapy professional organisation in understanding what it's like for people to live with long-term pain conditions? Are there things that are being missed? And are there things that you think would be useful that perhaps people aren't doing? So we're open to those possibilities as well. So some questions for you to consider. I think that brings us to a nice point to be able to conclude what we wanted to bring to today's session. But we would thank you again for inviting us and for giving us an opportunity to tell you about our organisation. Thanks, Kate.
Fantastic, thank you both, and then some really nice questions to finish on there to get us thinking whilst we move over to hopefully Pete. We've sorted, I think, in the background, maybe being able to share your presentation. It wouldn't be a webinar if we didn't have a technical hitch. It's an essential part of a webinar these days, isn't it? There has to be at least one technical hitch. So
Yes.
this is it, yeah, and we've managed to solve it in the background, which is fabulous. So I'll hand over to you now, Pete, if you're ready.
Well, how about that then? How about, as you say, it wouldn't be a good webinar without any hiccups and whatnot. Anyway, it's good for stress levels. Hey, listen, everyone. Good evening to you, and thanks very much for joining the webinar, and thanks very much for the British Pain Society for inviting me. And hey, listen, in the next sort of 5 or 6 minutes or so, I'm going to share with you a little bit about the pain toolkit. And as you can see there from the quote from the British Pain Society website, in England alone, we have 28 million people or adults living with persistent pain. And boy, oh boy, we are in a pickle. And this is where pain self-management comes in. And I think as already been said, I've been involved now for about coming up 30 years. Or it was soon after I come off the pain management program in '96, the input one, by the way. That's when I really started getting into self-management and coaching it and stuff like that. And but over the years, I've been networking with other self-managers like myself, not just here in the UK, but also around the world as well. And over the last sort of 15 or so years, I've been asking others what are the key skills that they use to self-manage their pain. And these ones kept coming up. So these ones I've really concentrated on now, and I've adapted the pain toolkit into using these more actually. We're still using the other 12 tools in the toolkit, but these are the 5 key ones now that we're using. and they're really simple, really. Setting goals, action plans, placing their daily activities, problem solving, meaningful movement. Hey, listen, this is really simple stuff, and it's not about we don't so much talk about the pain, but it's about moving on. I like to call it, it's getting people back in the driving seat, getting back on track, get the lives back on track, etc. But the main thing is really just keep it simple. I'm not an academic fellow one bit, but I like to keep things simple. So I can, the information that we put out there is useful for everyone, really. Just, a little quote there from someone called Pat. I like these tools, simple and doable. That's what it's all about. We don't, in a pain toolkit, we don't overcomplicate things. A little bit brief overview of how it all started, really. So it started back in 90. So I come off the program, but the actual concept I come up with didn't really kick off till about 2000 when I was working for an organisation in Germany, and they asked me, they wanted me to write something for their staff at their company, because they didn't really know it. They've never heard of any people with pain writing anything, and they were writing a learning module for their doctors, etc. So they asked me to put together a simple booklet for them, for the healthcare professionals, and that's where the idea of the pain toolkit come up. So really, it got going around 2001. We had the website come around in the early 2000s, and but we get on average it's about 275 a week inquiries. Mainly, it's funny enough. If you ask me, what's the ratio? Really, it's about evens, really. But a lot of healthcare workers, because they don't really get taught about self-management while they're in a respective med school, which is a drum I've been banging on about for years. But anyway, moving on. So the toolkit back in the early days as well, I was lucky enough to bump into someone called Angela Hawley, who was leading on long-term conditions at the Department of Health and Social Care. And they supported it by printing it off and sending it out to everyone, really. So I was really lucky. I bumped into Angela, but that got it cracking, really, and we got it out into people ordering it free, etc. Anyway, over the years, it's been translated into 15 different languages. I've been really lucky. We've never had any budgets or anything like that, and but organisations and around, in Europe and Australia, and they were kind enough to translate into different languages. And also, we recent years we've made it into audio books, so especially for people with visual impairments, and also people that like their information while they're on the move, etc. And we get a lot of people download that one. We run a monthly cafe that's for allied healthcare professionals and also people living with pain and self-managers. And the reason why, it's for both, really, because it's all about teamwork. Self-management is about teamwork. One can't work without the other. So it's important that it's important that the cafe includes everyone, really. I got the idea when I was doing some stretching exercise, and I was working out in New Zealand a couple of years ago in 2019, and it was a TV station. All of a sudden, it turned into a cafe. I thought, what the hell is this about? And I loved it. I thought, and we could do that when I get back to the UK, and so we've been running that since pre-COVID days, really. In recent years, in fact, last year we launched the Pain Toolkit Academy. I'll go into that on another slide in a minute. But it's a non-for-profit organisation that we started up, so that we can now. There's that missing link, as I say, especially for healthcare professionals. They're not taught about self-management, supported self-management while they're in their respective med schools. So we thought it was very important that the first course that we actually designed, I'm getting ahead of myself there, but we did it for, we designed it for healthcare professionals because we had to get them up to speed, etc. And anyway, I'll come on to that on the next slide anyway. But there's also, I've always, over the years, I've been looking for, not, I would say, innovative ways, but also ways on how we engage people, you know, and especially, I know people think VR is for young people, but it's funny when the platform I use it's a free platform, and the good thing about it, you don't need a headset. You use your phone, you can use a tablet or computer, etc., and you just sign up, make yourself into an avatar. And I pop into it from time to time, and it's interesting seeing everybody chatting. They're looking at all the different slides that are around the rooms, etc. And there's one there for, say, the pain toolkit one. There's one for on self-management for long-term conditions, etc. Going on AIP, a couple of years ago, I sat in a chair for 2 days. I was being asked questions about myself, my life, in the pain toolkit. And so this, if you go onto AIP, it's all the links on the website. You can go on there, you can ask me, you can actually interact with me and ask questions about the me, and ask me what football team I support and where was I born, etc. But you can ask me questions about self-management. And we do, you know, in my travels, going working around the world, etc. We run regular conferences now, and the idea that we actually started doing that. I do that with a buddy of mine called Keith Meldrum over in Canada, British Columbia, and because what we sort of discovered really that, you know, although self-management is getting legs now, it's sort of being more used. It's pain management conferences, but we wasn't really getting a fair shout really of exposure, you know, because, you know, at the end of the day, as I said, sort of self-management is about working together. And so about 3 years ago, we came up with the idea of actually coming up with running a pain supported self-management conferences. And we ran our third one in February. And what we do on the actual conferences, we have 6 speakers, 3 self-managers, and 3 healthcare professionals from all around the world, etc. Very well attended. The next one is in February next year. But what we did this year in February, we actually created a pain supported self-management week. So that was quite interesting. So we're getting people to get going, you know, do some activities, you know, not just here in the UK, but around the world. How they're celebrating pain supported self-management, etc. And we're doing another one in October. That will be for European, you know, for people living in Europe, etc. The different versions of the pain toolkit that I've been developing over the years. I won't read them all out. You know, you can see them there. But I've tried to vary them a little bit, really. I think I've noticed doing one. I actually wrote one, adapted it a few years ago for footballers who, people that know me, I'm a big Arsenal fan, and you know, they always get injuries, etc. But so I adapted a toolkit for footballers that get injured, etc. So, but you know, I'll be, you know, looking at everybody's presentations tonight. I'm really pleased to see so much going on, because when I started off back in the late 1990s, early 2000s, really, there really wasn't a lot going on. So really pleased to see that things are cracking on. Like, you know, it's really put some wind in my sails. Anyway, the Pain Toolkit Academy, as I said, it's a non-for-profit. And what we did is, you can see there on the right hand side is the we wrote that one first. We developed that one first because, as I say, there was a massive gap there. Like, you know, because it's about people saying about learning how to self-manage, and the thing is that why am I not being taught self-management stuff? Well, you know, healthcare professionals can't teach what they don't know, and so we thought it was important that we built this course so that they can learn the basics of self-management, so skills that they can learn straight away, really. You know, they haven't got to go on a massive course, etc., but just basic stuff based around our 5 key skills. And that's been really been popular down with healthcare professionals here in the UK, but also around Europe and around Australia, New Zealand, etc. And on the left-hand side there, you can see we launched the one there for patients on the left hand. Really see, the thing is now it's balanced, you know, so that healthcare professionals can signpost people to the patient one. And what we try to do is make it super affordable, really. You know, it's not, as I say, any profits that we do make is always played back into what we do, etc., the platform, because we want to do other courses, etc., and specialise in different pain conditions, etc. But also in the middle is, that's the interesting one, really. We're trying to build a community, really, you know, because it's already been mentioned today, and it's really pleased me that there's having that conversation. People learn from other people, you know. Years ago, when I was working in the NHS on the Expert Patients Programme, I was the lead trainer for NHS England for persistent pain. And what we found when we was running the Expert Patients Programme, people learn from other people. So on that basis, we've built a community up now, and that's really going good guns. There's a quote there from Katie Napton, who works with us on the academy and the pain toolkit. There's a quote there: "As a physio involved in this course, I've seen it transform clinicians." You know, Katie won't. She works with other. She's quite big, as I'm told. She's quite well. Talking to other physiotherapists, she's quite well known within the community, physio community, etc. So for her to say that, you know, while we're lucky to have her working with us, really, how these can help our colleagues, etc., how they can support us, like, you know. And nice little quote here from Dave Oxley, who's another pain self manager. And this course is so powerful; it shares a lot of experiences, and that's all it's about, you know. So, you know, going back to that, having that conversation. We learn from each other, you know, and that's the best way. That's how supportive self-management works. And, you know, just before I sign off, we've had to actually the Canadians actually come up with it, actually. You know, where we call it pain self-management. A lot of we were finding is that people were told, well, you know, you need to go and self-manage, you know, learn self-management. And they thought they was being fobbed off, like, you know, well, you know, a lot being cut loose. And so what we actually did was added the word supported self-management. So that way they're being supported, but they can only be supported if the healthcare professional is familiar and experienced in knowing about self-management, etc. And there's the website address for the academy. It's on the website as well. Hey, listen, it's been really good talking to you guys tonight, and I hope you found it useful. Pain Talk, a really fun, friendly bunch, and our main thing for us to do is keep information simple. Don't overcomplicate things. As I said, I'm not an academic though. I can't make things complicated because I'm not an academic dude, like, you know. But hey, listen, there's the website, there's my email address, and also all the things that we do on social media. Anyway, thanks very much for listening. Hope you enjoyed it.
Hi Pete, that's great. Thank you very much. And not a technology hitch in sight there. Everything went perfectly. So thank you very much for doing that. So that was our last speaker for this evening. We have got some slides and information that has been sent through. From the Live Well with Pain team. Emma has sent us some information through. So Live Well with Pain, just in case people are not 100% aware, they have developed many resources to help people develop new approaches and skills to live well despite persistent pain. And many of those tools and resources are regularly used across the NHS to try and help people with their pain. So what we will do after the webinar this evening, when we're putting everything on as on the YouTube channel, etc., is that we'll incorporate those slides somehow, or Esther will from the Secretariat, because I don't know how to do that, but we will make those resources available. So lots of questions actually have been answered. We've been replying to some stuff in the chat and some stuff in the Q&A as we've gone through. But my colleague Margaret Dunham, who's just come on the camera here, is also part of the Education Committee for the British Pain Society, is just going to help run through some of those questions, just in case we've missed anything. And if we have, feel free to pop it back in the chat again. I'll hand over to you, Margaret. Thank you.
Okay, thank you very much, Kate. Yeah, I'm trying to keep up with the question. People have been brilliant at responding. I think the only thing is a few things have been put in the chat as well as the Q&A, but I'll try and capture that. Question for Pete's just popped up. How long are the PAIL toolkit courses for either patients or professionals? Pete, I don't know if you want to quickly answer that. You're muted, Pete.
Sorry, can you ask that question? Ask me again. I was just having a sip of me lemon and
It's okay. Yeah. No, somebody's asking how long are the pain toolkit courses for either patients or professionals?
Well, I can do it. The good thing about it is they can do them in their own time, but we're
Okay.
there to support them if they need it. Like so, but on the old court, both the healthcare professional one and also the patient one, there are lots of videos there that we've recorded and put on there. But they can ask, it's like when they go back, because we've got that community based as well, they can post questions on there if they get stuck or anything like that. So, you know, but they can do it in their own time. And it's funny, when I dip into it, because I'll get up early in the morning myself, go do me meaningful movement, me yoga and whatnot. And I dip in there and I see people chatting away in there, you know, in the community side of things. So, but I know, because one of the problems with people with pain is sleep problems. So I know they go into it and they're doing it all sorts of times of the day. You know, there's no time limit to it, and it's just they can take their time but ask us questions. Simple as that.
Great. That sounds absolutely great. Thank you very much, Pete. I'm just going to dip back into the questions in the order in which they were asked. So thank you. So the first one was from about Millie answered this one about how you become a self-management course tutor. And of course, that links back to what Pete was saying. You know, it's really a burgeoning area of interest. People want to take control of their lives, and Millie put that link in. We will gather all this information up together, don't forget, at the end of this, I'm sure, and make sure that you have access to that. It will be on the recording, and we can try and post some of this in the YouTube channel as well as on the BPS website. Somebody also said, thank you, Millie, for an informative presentation and to be accessing the resources. And said, just reminding people that MSK pain and arthritis, though people talk about them in the same sentence, they're not actually the same thing. And I think that's a really important point. But the arthritis charity versus arthritis does largely focus on arthritis pain, but recognises a lot of other conditions that can cause MSK pain, including back pain. But most of the services from versus arthritis are relevant to people experiencing MSK pain. And there was a question about flipping pain. Do you have thoughts and recommendations about signposting to educational resources? And Sam posted in about the recommending the flipping pain formula. Again, there's going to be lots of links to amazing resources for you to access after this webinar. Sam says that in their experience, the tools can make a big difference, but even more difference with the support of a healthcare professional. Victoria was asked while she was talking about befriending schemes. Now, I think there is a befriending facility within Victoria's charity, but there are also more general befriending schemes available. And I think we put the link in the Q&A, which is absolutely helpful, because it is something you need to find somebody else who's living with that same experience sometime. Having that rapport, having somebody who has solidarity, understanding your experiences is vital. And I'm sure that sort of links very much with what Pete was saying about self-help. So befriending, there's a website about befriending organisations. Claire and Rachel put in great stuff about the Physiotherapy Pain Association, which supports obviously physiotherapists and the educational needs of them, but also is outward facing as well. And the final one we've already asked was about Pete's online cafe, which sounds amazing. And there's a link to how to book onto the online cafe. So I don't know if any more questions have popped up in the chat while I've whizzed through the ones we've had so far. But it sounds like it's been a thoroughly amazing evening. So much attendance, so much interest, and such amazing presentations. I'll hand you back to Kate.
Margaret. Rachel, I think, did you just have your hand up there, Rachel?
Yeah, I was just going to put that I've just put into the chat as well that with my other hat on, ignore my logo behind me for a minute, suspend reality. And so when I'm working as a Live Well with Pain facilitator, I was just putting in the chat that they also run programs to help professionals working with people who live with pain, and they run a training program based on their 10 footsteps program, or we do, I should say. And the sessions, there are 3 sessions running for 4 hours over a 6-week period, so sort of fortnightly. So that can be quite useful if people are finding that they're struggling to know how to work with people in that area as well.
Thank you so much. So we're just in the last few minutes now. I think unless if there's anything else that anybody wants to add, then I'll probably just wrap it up so you can have a little bit left of your evening.
Yeah, there are no more questions in the chat, but yeah.
And it might be that there's some questions afterwards. And so if we've not managed to get to a question, if we've missed it this evening, or if there is something that you want to ask, then you can send it into the estimate. So just double check me on this one, info at British Pain Society, or BPS. I'll get Esther to put in the chat, I think, what the email address is, and then we can forward those, any questions, any outstanding questions to speakers. So I would just like to bring things to a close. Certainly if there's people on the call, I'm sure there are, who are living with pain, including, you know, families, friends, carers. We hope the resources, the tools, the networks that have been shared are helpful, and that you can access a different type of support that's available, and hopefully broadened some knowledge and understanding around what is out there. That's what we were really hoping to get out of this evening. But also for all the people on the call who are working in health and working in communities, that are in training or research, that you can incorporate some of these resources into your practice. And finally, just to reiterate that we know that this is an example of some stuff that's out there. I certainly know of other things that's going on locally to the area that I live in, West Yorkshire, that there's lots of resources being adapted and produced for different pockets of communities as well. So there's lots of stuff out there. If anybody is aware of information, stuff that's out there that we can help promote, then please get in touch and let us know what they are, and then we'll do our best to share that when we're sharing the other stuff that's come out of the webinar this evening. It'd be useful, I think, for us to know who's been on the call in terms of your background, and appreciate there's some overlap in roles. You might be somebody who lives with pain and a healthcare professional, or a health, you know, we realise that there's overlap between those areas. But when we get some feedback, it would be useful for us to get a sense of who's been on the call tonight, to help us know how useful it has been for people with different hats on in different roles. So finally, just to extend my thanks to everyone who's joined this evening. Thank you for giving up your time. Special thanks to our speakers, of course, the Patient Voice Committee at the British Pain Society, our wonderful secretariat, who are always doing loads in the background, who without them, of course, none of these webinars would happen. So I will just wish you all a pleasant rest of your evening, and the recording, we hope, will be available soon. Thank you, everybody.